Hi everyone, my name is Zuhur Jeshi, and today I'm going to present my seminar project under the title of Childhood Obesity and Type 2 Diabetes. Like I said, my name is Zuhur Jeshi. I'm 25 years old. I have a bachelor's degree in nutrition and dietetics. I've honestly always had a true interest in nutrition. As a child, growing up between the ages of 6 and 9 up to 10, I was a little bit chubby. So I remember my mom always talking to me about healthy eating. I remember going to a nutritionist once, and honestly, this is when my interest in nutrition started to grow. I started to ask more about healthy foods, healthy options, and with the support of my family and my mom, my siblings, my dad, um, I really was able to lead on a healthier lifestyle. I gave up so many unhealthy food choices that I used to enjoy, and it just I started to read more about nutrition. And I remember telling my parents, telling my friends that when I grow up, I definitely am going to study nutrition, and so it happened. I really couldn't have imagined myself studying anything but nutrition. So 4 years ago, actually, I moved to Panama City, and I decided to pursue a certification in fitness training because I thought that it would go well with my nutritional degree, especially because I have an interest in exercise, and so I thought the combination would be great. Then I wanted to build up more on the knowledge that I had already attained through my bachelor's degree as well as my certification as a fitness trainer. I also worked at a hospital shortly after I graduated from my university with my bachelor's degree, and it was really a wonderful experience. It made me want to go deeper into the field of nutrition, and I also realized that I loved working with kids. I mean, I would see patients that were 60 years old, 40 years old, and 30 years old. I would also see babies and kids that were 7, 10, 12, and I was mostly interested in working with kids. It brought me so much joy, and I felt that um, helping them make changes is so promising. They are the youth, and they are the future of this generation, and starting healthy eating habits with them can have such promising results as a whole to um, the rising epidemic of obesity. After attaining my degree as a certified fitness trainer, I felt like I wanted to achieve more, I wanted to do more, and so I thought about becoming a health coach to have it go hand in hand with my degree in nutrition and my fitness training certification. But then I remember I was just sitting down at home one day and I thought, well, I've always wanted to pursue a master's in nutrition, so now's the time. And so I started searching and I became a candidate at the University of New England for the Masters of Applied Nutrition. I will hopefully graduate in the spring of 2020, so I'm really looking forward. Um, so 3 years ago, when I was achieving my certification in fitness training, I decided that I want to help people and I want to help them from the comfort of their homes. I want them to not have excuses to eating healthy, to making healthier choices. And so I founded my company that I called My Diet Expert. It is an online based service that helps clients purchase packages that are intended to help them reach the goals that they have set in mind. So I help people, women who are pregnant, I help people who want to gain weight, people who want to lose weight, as well as children. And so it has been really promising. I've had so many clients, and working with people from different regions has also opened my eyes and on different traditions, different customs, different ways that people treat food, and I have found it so helpful and so satisfying to be able to work with people like that and to be able to help them achieve their goals, help them make healthier choices, help them become healthier versions of themselves. So today, my presentation is intended to help all parents like you here of young school-aged children between 10 and 19 years old who are obese and diagnosed with type 2 diabetes, but also this presentation is not just intended for this target population, but also for all parents who have children and who are struggling with them, whether it's their weight, their issues with food. This presentation is here to help you, is here to shed light on the importance of helping your kids follow a balanced diet so that they can stay away from obesity and overweight and the health consequences that it carries along with it. Since I live in Panama, this is where my seminar is going to be taking place. I'm going to go over some background information to help you parents learn more about this topic of interest. Why is obesity on rise? What's the reason behind it? What is causing it? And so, chronic diseases and excessive weight gain among not just a certain population, but different population groups has unfortunately been on a rise, and diet has been the driving force behind it. There's always so many factors that affect that affect weight gain, that affect the occurrence of chronic diseases, but diet has been the driving force. And the question to be asked here is why? Basically, because people nowadays most commonly follow something that is called a diet that is called the Western diet. And this diet is characterized by high fat food consumption, high sugar consumption, and a relatively sedentary lifestyle. So, high fat food is foods like, as you can see on the picture, burgers, fries, bagels, chips, peanuts. People eat peanuts thinking that they are healthy food, and while they are actually healthy to a certain limit, but eating in excess is not a good idea. And burgers and fries are loaded with bad fats that are detrimental for our health. So, learning about healthier options is essential here to help make better changes in our diets, in your diets, in your children's diets. Also, the Western diet, like I said, is characterized by high sugar consumption, and sugar is found in so many hidden foods that we consume on a daily basis without knowing that they are loaded with sugar. So we have the obvious things like juices, boxed juices, sodas, even yogurts, yogurt drinks, the supermarket, the commercial ones, they are loaded with sugar. But then there are canned foods, sauces, dressings, ketchup, all those sauces and condiments are loaded with sugar. Diabetes is one of the oldest diseases known to man. It is a disease that is characterized by higher than normal sugar levels. Most ingested food is converted to blood sugar for energy. Now, the mechanism that should normally take place is that the pancreas makes the hormone insulin, and insulin takes up glucose that is basically the sugar that comes from our diet into the body cell. However, in type 2 diabetes, the body does not use insulin as it should. So what happens basically is if there is glucose in the blood, and the body is not using insulin as it should, so insulin is not picking up the glucose from the blood as it should. So glucose is basically building up in the blood. This sugar buildup in the blood can in turn cause damage to multiple organs in the body, such as kidneys, the eyes, heart, and the nerves. The kidneys, people can suffer from kidney failure, chronic kidney disease, basically. The eyes, they can suffer damage to the cornea, which affects eyesight. They can suffer damage to the heart or the nerves, which in turn may cause degeneration of the nerves. Now, in severe cases of type 2 diabetes or cases where the diabetes has not been treated or controlled, limb degeneration as a result of nerve damage can take place, and unfortunately, if that is untreated as well, it can result in amputation. Now, over here is an image of what is called a diabetic foot. This diagram is here to help you understand what happens when diabetes goes untreated. So basically what happens is nerve damage occurs at the area. This nerve damage is called neuropathy, and it in turn causes reduced blood supply. Reduced blood supply is what is often referred to as ischemia. This causes pain and numbness in the area, which in turn leads to deformity, and then ultimately an ulcer. An ulcer is basically, it looks like a red spot with a hole where the skin is exposed, and this skin that is exposed becomes a home for bacterial growth. And unfortunately, when bacteria grows in this hole, if it goes untreated, it can cause what is called as gangrene. Gangrene is basically when the foot turns blue or black due to damage and reduced blood supply. Basically, actually, there is no blood supply when gangrene happens to that area. So this leads the doctor to have to amputate so that the damage does not extend further up into the leg. Obesity is unfortunately associated with so many health consequences, and the list is big. From cardiovascular diseases to stroke to hypertension, which is basically high blood pressure, type 2 diabetes as discussed, hyperlipidemia, which is basically too many lipids or fats such as cholesterol and triglycerides in the blood of an individual, which in turn the abundance of this fat in the blood causes the arteries blockage, which in turn calls for more health consequences. Obstructive sleep apnea, which causes breathing to repeatedly stop and start during sleep. And basically this happens when the throat muscles relax and block the airway during sleep, and is caused by excessive weight gain. Liver or gallbladder diseases, or gynecological problems. Obese children and adolescents have a higher than normal body mass index, BMI, which will be discussed in later slides. Body mass index is strongly correlated to diabetes and insulin resistance. Like I mentioned, diabetes type 2 it happens when the body does not use insulin as it should. This epidemic has led to an increased prevalence of type 2 diabetes in children and adolescents over the past 30 years. The American Diabetes Association suggests screening for type 2 diabetes as early as 10 years old. Screening at such an early age helps prevent the occurrence of diabetes. There are so many kids who are not necessarily diabetic, but during screening period they are diagnosed as pre-diabetic, and so making the proper alterations in their diet, their eating habits could ultimately help them avoid becoming diabetic and managing it before its occurrence. There are definitely some criteria that are used to diagnose type 2 diabetes, such as having a fasting blood glucose of 126 milligrams per deciliter, having a 2-hour fasting glucose level greater than 200 milligrams per deciliter, when an individual experiences polyuria, which is frequent urination, or polydipsia, which is excessive thirst, and an unintended weight loss. In type 2 diabetes, this is one of the criteria that also helps diagnose it. A recent study assessing the prevalence, the occurrence of obesity showed a positive relationship between being overweight and obesity among children between the ages of 2 to 19 years old, and mostly among adolescents. This basically means that as the children progressed into adolescence, unfortunately, obesity or the state of being overweight was on a rise. It was a positive relationship. By 2010, no state in the United States had an obesity rate less than 20%, which is quite a lot. It is a shocking number and it is so unfortunate. And if that was in 2010, we can only imagine the rate that obesity has reached by 2019. Children with and adolescents with a body mass index BMI greater than the 95th percentile has increased in the past 20 years. So what does having a body mass index greater than the 95th percentile mean? BMI is a tool used to measure if individuals have the right weight for height. It is plotted against a growth chart like shown here in this slide. The weight is plotted and the height is plotted, or the weight for the age or the height across the age, and the two lines meet at a single point, and this point lies on the graph and is therefore then analyzed to which category it belongs. So basically, there is a section or a part of the graph that is less than the 5th percentile, and any dot that lies below the 5th percentile, this child is considered underweight. If the joining both lines lies between the 5th percentile and the 85th percentile, then this child is at a healthy weight. If the point joining both lines, however, lies between the 85th percentile and the 95th percentile, the child is considered overweight. And if joining both lines results in a dot that lies at or greater than the 95th percentile, then the child is considered obese. Children are therefore at risk for shorter life expectancy even before upcoming adults due to the rise of obesity. A study shows higher incidence of type 2 diabetes among youth for Hispanics as opposed to non-Hispanic whites. And I've been living in Panama for 4 years, and it is shocking how many kids who are Panamanian that I come across that are obese, that are overweight, and I really think that this issue should be addressed. As per the CDC, the Center for Disease Control, Hispanic people are 50% more likely to die from diabetes than white people. And the question to be asked here is why? After living in Panama for 4 years, I have learned so much about food, traditions, and customs, and staple foods, what breakfast usually looks like, what lunch and dinner snacks usually look like, and they are loaded with fats and sugars. People here rely heavily on fried foods, high sugar foods. So in the morning, for lunch, dinner, there is always some arepas on the table, which are basically corn-based tortillas that are fried and stuffed with lots and lots and lots of cheese or beef, fatty beef, or chicken, or empanadas, which is like a kind of dough made with butter that is also loaded with either potatoes or cheese or chicken or beef, not to mention the sugary drinks, the tamarind juices, mango juices, passion fruit, or the desserts that are always loaded with condensed milk. Something that people absolutely love is called dulce de leche, which is basically like caramel, but it's so thick it is made from condensed milk, and it is a staple in almost all desserts I can think of that I have tasted here. And so all of this adds up to a rather unhealthy diet and more incidence of overweight and obesity. The Viva la Familia study studied genetic and environmental factors contributing to childhood obesity among the Hispanic population, and results showed that 91% of parents were overweight or obese, and not everyone had accessibility to healthy food. And this just shows how parents being obese or overweight and having unhealthy food habits negatively impacts the health of their children, their well-being, and their um, tendency to become themselves overweight and obese. So what should be done? I mean, intervention is essential in a situation like this, and interventions in this area can be approached in so many ways. Intervention for helping youth make healthier choices starts early on, and it should start not only at home but also at schools. Kids spend so much of their time at school, and over there they can be educated about healthy eating. They should also be provided with healthy food choices rather than unhealthy food at the cafeteria. So a review studying the effect of physical activity interventions for treating overweight and obesity alongside type 2 diabetes showed that family-based interventions had significant results in helping children make healthy changes, because children get more encouraged when they see that their family, the people that they care about, are also engaging in healthier changes to their diet. A school-based intervention promoting physical activity and diet changes showed decreases in obesity. And this only lies further importance on the significance of intervening in schools to help kids make healthier choices, because kids are encouraged when their classmates eat healthier choices, when this is done as a whole, they are more willing to eat healthy. Parental support, as mentioned, has shown to be effective in helping 6-year-old children, a study says, eat healthier food items as well as sustain those habits long term. In this seminar, you will be able to identify factors that lead to obesity and the resulting health consequences, explain type 2 diabetes and factors that result in its occurrence, describe accessibility to glucose monitoring and the process of insulin administration, as well as list some healthy lunchbox ideas. The outline of time spent during the seminar is as follows. The total presentation is 30 minutes. The introduction is roughly around 5 minutes. The presentation about 25 minutes. Questions and answers will also take place for around 10 minutes, and the activity will be around 90 minutes. The program goals. This seminar is intended to help you parents and your children learn more about the risks of being obese and what leads to it. It is also intended to help you learn more about type 2 diabetes and how to successfully manage it. The materials and equipment that will be used in this seminar are quiz flashcards, healthy food items, plastic lunchbox plates, a bento box lunchbox, potato sack, and tag game accessories. The activity plan is as follows. Part 1 is a quiz that will take place over a time frame of 20 minutes. You and your children will ask each other questions in order to make sure that both of you learn about the factors leading to obesity and the resulting health consequences. And the quiz will also cover factors leading to type 2 diabetes, insulin administration, and glucose monitoring. This type of interaction really helps both kids and you as parents grasp the concepts that have been discussed in a more comprehensible way. Part 2 of the activity is building your healthy lunchbox station. You will be introduced to healthy lunchbox ideas with your children. Then you will be given empty disposable lunchboxes and ingredients such as vegetables, fruits, complex carbohydrates, and proteins, and will be asked to assemble and make your healthy lunchbox. The winner with the healthiest lunchbox will receive a bento box lunchbox for free. Yay! Those bento box lunchbox are really super for any parent with kids. I know because I send it with my child to school every day, and the compartments, having everything divided, makes the kid just so excited about trying different foods that are in the lunchbox. And trust me, whenever I put food in this lunchbox, my kid comes back home with the whole thing, just nothing in there, it just vanished. Part 3 of the activity plan is the Get Moving station, which will take place over a time frame of 40 minutes. You will engage in fun activities with your children like potato sack and tag. This will encourage your children to get moving while still having fun. Your children will therefore look at exercise as something fun rather than a punishment, because there's so many kids that look at exercise as something so daunting, and it's important to remind them that it's actually fun. They can do it with people they enjoy doing it with, like their parents, their friends, and their siblings. Thank you all. I hope you enjoyed this presentation. Please let me know if you have any questions. I will be opening room for questions and answer sessions so that I can tackle anything that I didn't discuss, that you still have more questions about, something that you are still concerned about. And thank you for listening again. Here are my references that I used for the seminar. Thank you all.